Okay, I have so many questions. I think this is sort of for first Mr. Gerlinger, but it's also for all of you. There's a bunch of questions sort of on the same theme. It's really about how do you get staff buy-in, right? So how do you convince that reluctant, hostile chef to the patient experience, or the patient experience who does the, here comes the gluten-free people, right? Or the vegan, to not, to believe.
I guess I should have looked at those questions earlier when they were sitting there. So it's a process, right? So we were just talking on the side here about this. Not everybody believes right away. Work with the ones that do believe in it, and I think what helped was that as I said earlier, that Chef Bruno had 3 chefs following him right away. That created just this groundswell. It started that groundswell that then the others saw like, oh boy, that's a different standard. You heard one, Chef Russ, actually talk about that in the video when he said it was scary. It was a little bit intimidating at first, until they realized that we're here to make this better for the patients, better for the employees. In many cases, the administrators were difficult also, so that was difficult to convince them. They were worried about cost. They were worried about, or that status quo was just fine. There were lots of individual battles. I mean, it sounds all great in a 30, 40-minute presentation, but it was hard work. It takes also, and it takes what I call air support from above me, right? If I had the support from the CEO, that helped tremendously. That's why that statement, the food and nutrition commitment that I showed you, was so important, with Michael Dowling's signature on that. That's kind of the thing that we could always fall back on, say, you're still cooking all this stuff with the bad ingredients in it. This is what we committed to. So I would say, start there first.
Chef?
I think he's right in terms of the air support and having that commitment from above and having a pretty clear mission about how you're going to do that. But I think from the individual perspective, you have to want to serve other people and have happy outcomes. There are a lot of people that are just resistant to that and or just don't get it. And you have to start with one chef or a couple chefs or a couple administrators and go for there and build enough acolytes out there that are going to do this until the peer pressure mounts it. People are going to self-select out, or they're going to buy into the program. And once they see the success of that organization together and it becomes more integrated into the culture, I think it becomes much easier to do. I mean, I mentioned food allergy. We've been doing that for, over 30 years. And last night I was in Whispering Canyon Cafe, a place that does family style meals for about 750 people a night. That sous chef had 30 food allergies that he had to go out and touch individually. So 30 people over the course of a 4-hour shift. I don't know how much time that man spent in the kitchen, but I know it wasn't much because I was expediting. But he had commitment, and this is what we're going to do to make this business work. And all the cast members were extremely forgiving of him for having to do that, because we knew ultimately that was a success and that was the mission of our organization.
So I'm going to add on, I've been told no pretty much my whole career. So I've heard that a lot. I don't really hear no. What I hear is find another way to convince me to say yes. And so I tell my son this all the time. There's more than one right answer to a problem, and it's just figuring out how to get that yes, I think, in some cases. And so sometimes it requires a bit of creativity, a little bit of passion, and then also, I'm going to say in the case of Sven, just feed them, feed people and convince them and make it tangible. And once they do see that, or they hear the patients, or they see the food, sometimes there's an aha moment that happens that will change a person's mind. But I bob along, no, no, no. And then I come back the next day, I'm like, what about now? Still no, still no. Okay, we're going to work on that.
I have one more thing to add, and that's something that I've learned along the way also is if you can't change people, you change people. And unfortunately, we had to do that in some cases as well.
All right. There's so many good questions. I guess this is both for Lisa and Sven. Oh, and Jeff. How did you get the healthcare system or the hospital to really embrace the idea of antibiotic-free? Like, where does it have to come from for them to really embrace that?
Okay, I'll go ahead and start. So I will tell you that the way the nature of our food service business is that this comes from the client request. So our hospital administrator says, hey, you can do food service at our facility, but this is how you're going to do it. In our own company, we do purchase certain products that are NAE as part of our standards because they don't have a cost difference to our model. And so in those opportunities, like for example, NAE turkey breast, it took us forever to convince in our organization managing 1,000 hospitals. It took some creative work, a lot of no's, where they said, no, you can't serve NAE turkey breast because it's too expensive per turkey breast. But then we bring the chefs in and we say, yes, but the yield per serving, look at the cost of the yield per serving, because the regular conventionally raised turkey breast, while it's cheaper per breast, it is not yielding as much as the NAE, nor is the quality or the flavor there. So sometimes it's changing the paradigm or the box that people put themselves in and saying there's a new box and I want you to look at this. So that was part of it. So NAE turkey breast became part of our program, and every chef, everybody who purchases has to purchase that. Going into the hospital system, this took creative use and partnerships with our physicians and our antibiotic stewardship physician. He led the committee. He put his foot down and he changed the mind of leadership and said, come in here. Let's talk about how many people have antibiotic resistance in our healthcare system. Look at all of the deaths. Look at people going into sepsis. Let's look at the cost of sepsis. And let's say, do we want to make change in our food service program? Are we going to be the people to put the stake in the ground in the New Jersey market and make that change? And they said yes. And then for us, it's just a matter of executing, and that's easy enough to do.
I love that. And that's, I think, a very sophisticated way to go about that, to bring the physicians in and to build the case. I wish we would have done that. We just said it's the right thing to do.
That's okay.
So, and then approach it from the cost angle. I think that was the most, when you talked about that, was probably the biggest fear, that it's going to be more expensive. But again, using our purchasing power, we have a very, very effective procurement department. I will never want to sit across from our chief procurement officer in negotiations ever, if I ever have to do that. So using that, and then also, and that applies to all of the changes we made, if there are areas where it costs more to do it and it's the right thing to do, then we were able we were looking for offsets in other areas. And that just applies globally. Then we found $250,000, $250,000 a year in savings from a coffee program, for example, to serve better coffees at a lower cost, and then we were able to basically reinvest it back into buying some other better product somewhere else.
So actually I have to go back and ask our protein buyer, who's been there for a long time. Chickens don't come typically with antibiotics, and I know the beef, we had multiple discussions about that, and it does come back to quantity that's available in the supply chain. But I'll go back to what Lisa said, from a chef perspective, yield differences are very important, and sometimes that's hard to explain to other levels of leadership. But she also mentioned the taste component. And to me, that's one of the foremost issues, and also hard to quantify and sometimes hard to explain. but I do believe there is a satiety value to great flavor. So if things taste good, you can probably eat a little bit less than trying to cram all this stuff in your food, because you're still like, I know this will taste good later as soon as I get enough in my stomach to where I feel uncomfortable. And the analogy I always use is take a piece of great chocolate. Take a piece of Valrhona 75% chocolate, dissolves at body temperature, let that dissolve in your mouth and see how you feel. Take a big chunk of a harder candy bar and chew that and see how you feel. I guarantee you there's going to be a difference, and you're going to feel a lot better. I'm sorry to use the brand name with the previous version than some of the other more commercial brands. And you'll also look at the ingredient list we talked about earlier. The ingredient list on the other one will be far longer than what you're going to find at that 75% Valrhona, which will only be probably like four ingredients.
Question for Chef Jones. What kind of heat source, what are you using in most of the Disney kitchens? Have you switched to induction?
So that was probably one of the projects I was working on just before I left the company. But I personally am a big fan of induction. I think that has huge opportunities. And as you see municipalities and states trying to limit the amount of gas in kitchens, and especially in new construction. But you think in terms of us, Disney, to go and crack a 50-year-old kitchen, Tony's Town Square in the Magic Kingdom, and you convert that to electricity, this is the big problem. It's also fabulously expensive. But we are testing induction in a couple of places. And we've talked about it in terms of, I think you can do anything on induction you can do on gas. Some of my friends in white coats might disagree a little bit, and maybe there are a couple similarities. But at the same time, let's consider some other factors, right? It's a lot safer. It cools off as soon as you take the pan away, so there's a safety issue. It only takes a couple of burns to like run up your budget in a really big hurry. It's also going to reduce the ambient temperature in the kitchens as well. So that's great for the culinarians. If you've stood over a range for 12 hours, it's depleting, to say the least. But then from a cost perspective and new build perspective, consider the cost of your HVAC systems. If I can drop the energy that's required in there by a couple of degrees, that's a pretty significant improvement over what you're doing. And that, of course, then affects your emissions criteria and everything else that goes with that. So I'm a big fan of induction. It's just going to be super hard to implement in a lot of places.
Right, so the retrofit is the problem.
In a lot of cases, yeah, it is.
Yeah.
It is retrofit. So maybe it fits in. Once it's all incremental, right? If I can replace one stove and do that, but an example I was using is we're changing an entire kitchen, a quick service kitchen, to all electric. So that's great, but now you have to remove the gas lines. You have to add new breaker boxes, which requires new wiring that then goes to the outside. And you need to think about, what does it look like from outside? Does that go back to the transformer? Okay, now you're in for another couple $100,000 more. Now, okay, it's there. Now does it have to go back to the substation, because I have all these other places that feed into this existing transformer? And it can become fabulously expensive when you're going back into retrofit locations. But where it can be done, every little bit helps. So where it can be done to start with, and I've joked with our designers, they build these, what I call stainless steel memorial kitchens that you can't change for 1,000 years because it costs you a small fortune. Whereas today, okay, why don't I just put in 6 or 8 induction burners and build the electricity? I can plug them in, a couple $100, I can change those out as they go along, and I've solved the problem. And then my kitchen is set for the next 20 years, and it's mobile. I could do whatever I could do, much like Morrison was doing with their teaching kitchen. Same philosophy. I don't need to have all this stainless steel infrastructure that is impossible to change.
I was going to add, I think you definitely hit on it. The kitchen, the age of the kitchen, sometimes you can't even get Energy Star equipment approved through administration, right? Because the cost is so much greater. So trying to drive ROI is, it's a dicey game. People are like, that is not real money. But I do like what you said about the cost savings of the HVAC, keeping staff, I think labor, oh my goodness, making people happy in the kitchen, I think is going to be a huge one. But then the cost of changing out the equipment to cook on, and then also looking at food service in large volumes. How do we do institutional food service on induction? My dad, he sells this equipment weirdly. He's retired Navy, but this is his side job to sell really high-end equipment. And we do induction at his house. And he's, trying to switch me off my gas, which is really, I know, so hard to do. I know, but I'm going to do it one day. But we do have people in healthcare. Pay attention to who and what your mission is in your hospital system, because if you have a mission to go carbon zero or carbon negative, guess what? It's coming. So this is definitely something to keep listening for. I think it's going to be a hot topic.
So this question is for you, Lisa. Have you seen any changes in the health of staff, weight loss, improved glucose or cholesterol since after they go through some of the teaching kitchen?
That's a great question. I believe that for what we've been doing with the pop-up teaching kitchen, really it's just anecdotal responses where people feel really great or they're happy or they feel like they want to support initiatives. But I think that if we had a culinary medicine program that was consistent, we would definitely see outcomes. I do know that Cleveland Clinic has a program that they use, and there's been a lot of great research coming out with some outcomes. You can look at some of the research that's done at Teaching Kitchen Collaborative. I know Northwell, you're a partner there, but they do a research day once a year, and I believe they have some research posted there. And I have some of the abstracts if anyone's interested in looking at some of the outcomes. But personally, from the way that we do mobile teaching kitchens, there's just not a way to really do the right kind of research to see outcomes.
Chef, can you explain more about what you mean by trash fish?
Yep, so trash fish, if you're a commercial fisherman, you're out there generally looking for one species. So everything else that shows up in your net or in your trap becomes trash. Or there are species out there that are viewed as totally unusable. An example might be, all I can think of is Cape shark, but that's not the name of it, off the coast of New England. Let me use an example here. Lionfish. So highly invasive species around the world that produces millions of eggs. It eats our reefs and everything within them and rapidly depletes that ecosystem. The only way it can be efficiently fished, relatively efficiently, is by spear gun. But if it's caught in nets and whatever, it's basically trash fish. Nobody wants it. I mean, it serves a purpose, perhaps negative outside of its natural environment because it has no predators in this particular area. And its spines, if you touch them, are not good for your health on a good day. But really, trash fish is anything that isn't desirable. I'll give you another example as I'm talking here, thinking about it. Longline fisheries, for tuna or for swordfish or whatever, will have other species on there because those lines are set for, they soak for, 18, 24, 36 hours or whatever. They're out there 4 miles in the water. So you catch, you catch every other hook is your target species. Everything else goes in the trash. So because I'm the turtle or the shark or whatever that is my life that useless? I served a purpose in that ecosystem. So there are other ways to do that because fish are seasonal, but they also live within certain strata within the ocean. So they can set those lines to improve the process by putting it to that strata in the ocean where they're trying to catch that particular species. So fishers are becoming aware of it because, again, you've got to do something with that fish. So it's waste in time and money and effort to do that. So there's a lot of work to be done in the fishing industry, and they don't always necessarily like to talk about it.
I have so many questions on costs, a lot. So the first one I'm going to start with is the mobile kitchens. First one is, how are they transported? Part one. Part two is, how much do they cost? And how long and how much setup does it take to, once you've moved it, to set it up?
Okay, that's it. Those are great questions. And if you guys had a personal, if someone in this audience gave the question of how long it takes, I actually have a 2-minute setup video that's part of the video training that I can send you, which makes it very easy. It's transported in a container. I'm going to say it's about this high, and it's round. Everything goes into the container. So without the video, you have a lot of polls and you're like, what do I do with this? Why we have the training video. Super easy to ship. It's $150 to ship anywhere. It all goes back in. It uses this 3 6-foot tablecloths. The tablecloths look like cabinets. It's just a fun little way of transporting. It costs about $7,000 if just for the tablecloths and the pop-up. But then if you wanted to buy small wares and actually integrate like a teaching program, it's another, used to be $3,000, it's like almost $4,000 now of smallware equipment for 14 trays, which is what we recommend a teaching kitchen class size to be about 12 to 14. You can do it in a big setup like this, and you can just do like the front row as your participants, and hey, this is the Price is Right, and you get a ticket to come down. So it's also not limited to just small groups. You can do a teaching session. I did it at the Florida Academy, actually, Barb, with all the dietitians there. So it's a lot of fun. I think that's about it. You can, we use a program, Camelback Displays out of Arizona, if anybody's interested in reaching out to them.
This is a question for Mr. Gerlinger. Equipment changes, staffing changes, menu changes, cost.
So, first of all, I learned so much about induction now and electricity and now about fishing. So I want to hang out with chefs some more. And so the equipment, a lot of those improvements have been made without changing the equipment, actually. I can tell you, Huntington Hospital was the first one to get to the 90th percentile. There was Sarah speaking there when she said they were in the 16th. They changed their model from a tray line to a room service line. They found some capital dollars to do that. They didn't really spend any more in staffing. It was all about training, commitment, changing the menu. The equipment may have been, I think it was $60,000 to $80,000, something like that, to changes. That's the investment they made. Other areas were just, we had equipment where it was so old that we couldn't get the parts for it anymore. So having a new model or not, we had to change it anyway. We had to repair the gas stove or whatever. We've created also so much momentum around there. We just got a $100,000 donation from one of our donors who donated a new kitchen to one of our facilities, which was pretty cool. But we didn't make a lot of investment in that. We had to change some cafeterias because they were just so old, and there would have been a regular refresh anyway. We are fighting over capital dollars, and I think the other was about staffing, right? We didn't we raised our minimum wage jobs along with New York City. We paid more for the executive chefs. There, just to be competitive with the restaurant industry, we probably paid 30-40% more what they were making before. I had to convince the hospital CEOs to pay for that. But then I remember conversations. They said, "Well, if I just pay $10,000 more, what type of chef can I get then?" So they got excited about it. Seriously, that's what it was. But also what boggled my mind was this. New York City, obviously, wages are a lot higher than many other parts of the country. We paid our executive chefs like $60,000 to $80,000 a year. My daughter just graduated nursing school, and she started as an ER nurse, as a new grad, and she makes $100,000 in New York City. So we were paying a chef who's touching every single patient 3 times a day, who has an entire kitchen staff reporting to them, massive responsibility, I would say. And we paid them way less than a bedside nurse. That's wrong, right? So that's those are some of the things that once you change philosophically and you make food more important, then, and you get the leadership actually to buy into that, that changes the conversation. And what also I always think about is how food service is in the category in hospitals in ancillary services, right? So what does ancillary mean? Ancillary means in support of the main activity. But what's the main activity? The main activity is that we're healing and that we are providing health and wellness to the community. And food is part of that. And if you truly believe that, and if you set the system up that way, then it's not ancillary anymore. Food is part of the main activity of healing the patients. And that's something that I think we've arrived now. It wasn't always like that, but it's just step by step to get to that.
Thank you. That's a great answer. Chef, what software program did Disney use when they were developing the Mickey Check, Disney Check program?
That's proprietary, so I probably can't tell you that. Actually, we used, I still won't tell you that, but we used a relatively new program because there were programs that you could get through school, or there was Seaboard, some of the folks at Cornell had developed, and we'd experimented. They were all really expensive, but those programs are all kind of like in a box. They're all pretty similar. We're an extremely complex organization with 34,000 recipes just at Walt Disney World. So you think about here and that on Disneyland and the cruise line, how you want to do that. And some places didn't even have the database to even be able to accommodate what that would look like, and the ability to shuffle that or say, hey, I'm going to update X recipe. Can we have the digital integration to make that go out to 150 restaurants, simultaneously in real time? Or you guys have mentioned supply chain challenges. We change an ingredient. How does that ingredient change in the database? And then what are the ramifications of that? Because if we were required to publish nutritional data, that would be a challenge. That puts the whole organization at risk. So we eventually found a company that we've been working with a lot of add-ons to their software, but then we also had to add in staffing that could run that, because now you're into also, who owns the data, right? Do they own the data? Do you own the data? What's the accessibility of that? Cybersecurity is huge at Walt Disney World, because once you get into nutrition, as you all know now, then sometimes there might be patient data associated with some of that in some of the programs. I developed a program for a menu for Gary Jones. I'm going to store that in my nutritional database. Well, now you got potential HIPAA problems. So it took the initial program that we used. It worked. I won't tell you it was great, but we got us over the hump. And in the last few years, it took almost 4 years to find a program and get them to contract stage where they could actually do that. So I would encourage you to look at as many companies as you can, deal with the RFP process. It just is what it is. But what you learn, and have them come and do demos and ask them about security and expandability, because you're going to want to expand somehow or some way. And in the data security piece, it's huge, ridiculously complex and not inexpensive. Don't go with the first bet.
Next question is for you, Lisa. How did you get HelloFresh to work with you? Like, what was that relationship? Did they donate? How did you set that up?
We just asked them, weirdly. But they are in this space. They also work with another healthcare food service company that to have a partnership, and we don't have as deep as a partnership as they do, where they've committed to buying certain numbers of boxes, and that would require money. Our particular partnership does not have that kind of financial relationship. And so you'd be surprised. Sunbasket is another one that we work with for medically tailored meals. They have a direct, I sound like a commercial, but they have a direct home to shipment program. Literally, you just have to ask, and that's what our leadership did. And you'd be surprised how many people are interested in trying to get out in this space and do something different. And when they hear what you're trying to do, ideas, they get excited too. So don't be afraid to reach out. You'd be surprised at how willing these types of meal delivery programs are interested in participating with you. Here's the thing. The cost, it depends on what you want to pass the cost to your consumer with. That's a thing. So in order for us to use a program, it still costs. It doesn't cost us any less. It's not free. So it's $50 a participant to do the box. So you just have to budget. But they're willing to do the big group relationship.
Can I just add on to that for a second? So I thought it was a fascinating idea. So when you think about training for your culinary people, not everybody can go to culinary school, or you may not have access to that in your local community, but there are online schools. I think Johnson Wales probably does some work, but like Ruby and Escoffier does online programs. And one of the challenges we had is, because we're a union environment, how do you provide equal access to everybody at the same time? And do you do it at work? Is it paid? Is it out of work? Whatever that is, a tuition reimbursement and or not. But the HelloFresh or Purple Carrot or whatever, a program like that then would say, geez, I could have Gary doing week 1 of a Ruby program, and his food is delivered. And that way I know everybody's getting exactly the same thing. Yes, it's a cost, but if a 18-month program costs you, I don't know, $4,000 for tuition, and okay, add another $4,000 in for food, sending them to Johnson Wales or CIA or another culinary school is going to be multiples of what that is. And Sven mentioned it earlier, training and finding the right talent is key. That will pay off in multiple ways. I know it's a hard sell sometimes, but that will pay off for you in your kitchens, your food costs, your waste, and all those other costs that are associated with that. So look seriously hard at that, but that is a superb idea.
I'll give you another little trade secret. Instacart is another great one. So if you can set up your profile with Instacart, they work with any grocery store, almost any grocery store. You can actually work to set up a certain profile grocery list and have that turned around and have someone's local Instacart deliver to them. So it's another one.
We're also in discussions with Instacart right now, actually, to create the stores within Instacart for our community health efforts around the food insecure population, but also then to create baskets and things like that for the teaching kitchens.
Chef, another question for you. Does Disney have a fry oil waste program?
We do. It's all of the oil goes out into a big bin and it gets picked up. Years ago, it used to go, and it still does at Disneyland actually. It goes off and becomes biodiesel. Ours did as well at Walt Disney World, and that changed somewhere around the pandemic time because of the cost of biodiesel exceeded the cost of regular gas. So there are other accommodations being made, but it is still picked up because it's a regulated waste, at least here in Florida. So we have to manage it and get that off. One of the challenges with the culinary, grease is grease, right? So you clean the griddle at night and dump the grease traps in there, and you think, well, that's all grease. Well, it's not. You got about this much grease and about this much water and soap, and they just go out and dump that in there, which then contaminates the whole mess and makes it really difficult to deal with. And or you have all the little scraps, politely called fond, I suppose, but I call it garbage. That goes in there and it immediately sinks to the bottom. So now all your drainage systems are clogged and becomes a challenge. In a couple of the new resorts, we have automatic filtration systems. So like Toledo at the top, 12th or 14th floor is automatic. So it filters, and then the grease goes off and goes zoom off into some remote box someplace else, because taking grease down 14 floors in an elevator is not good, regardless of how safe you think that process is. So it worked out pretty well. Also, obviously, pretty expensive, but yeah, it has to be. There's a disposal process for almost everything. It's just figuring out, exactly what that is, and can you and/or your community deal with it.
Sure, you're really glad right now that you don't have to deal with fryers anymore.
Exactly.
All right, well, thank you so much to all of our panelists. Just like I'm back. Just like we've done for all of our panelists, we have these beautiful aprons for you. Just really thank you for your great information, for sharing what you do, for your passion for health and food. Thank you.
Thank you.
Thank you all. Thank you. Yeah.
Another round of applause for our amazing speakers and panelists today. All right, if we can have the closing slides put up with our CME code for today. So I know that there have been a couple questions on getting your credit each day, so I just want to clarify that process. I'll also send out an additional email later this afternoon with screenshots of that process. Once again, after you have created your account in the GWCME system and paired your mobile device, for today, you are going to text this 6-digit code to the number below. That is going to confirm your attendance and unlock the credits. You then need to take a third step. So step 1 is creating your account and pairing your mobile device. Step 2 is texting the code. Step 3, you need to go back into the GW system, go to your account, My Activities, select Pending, and under Pending, you will see all of the activities that you attended. You'll click on each individual one, complete the evaluation. So on the left toolbar, you'll see evaluation with the drop-down menu. Select that, start the evaluation. Once you complete that, you'll be able to download your certificate. And that is the last step of claiming credit. You will need to do that for each of the days that you attended. And if you did any of the optional classes on Thursday or today, if you had that separate registration, you'll also do it for each of those classes. I'll send out some additional instructions with screenshots because I think that is most helpful when I need to do something, having those screenshots for that third process in there. We really appreciate y'all's feedback while we transition to this new system. So thank y'all for your patience. And if y'all have any additional feedback as you're using it, feel free to send that my way. With that, I'm just going to transition it over to Dr. Harlan for some closing remarks.
Thanks, Chef. The people here at UCF have been amazing. Dean Wong, Chef Jay, Ms. Raymond, Chef Cesar, Nick, David Stoneburner and his team, the AV team. Give it up for the AV team. As always, nothing in our lives would occur, mine, Carrie's, Barbara's, without Cecilia Hatfield. Nothing. Thank you to our speakers today. I think an amazing set of speakers, an amazing panel, testimony to the fact that this is the largest Sunday crowd we've had in the last 3 years. So that feels very good. We will be back together again next year. I'm going to talk about that in just a brief second. Somebody reminded me today, though, if I get a little verklempt, I'm sorry. Somebody reminded me today that those thanks go back further. Ben Sachs, who was going to be able to join us this weekend, who was my dean at Tulane in 2009, came to a group of us and said, I want to build a teaching kitchen to teach medical students to cook. Now, I initially thought that was a dumb idea. I will tell you, and for those of you who know my background, you would have thought maybe the opposite, but the more we thought about it, and the more we talked about it and what we were going to do and how we were going to do it, and none of us would be sitting here today without Ben Sachs. And probably, I think, this whole movement of teaching kitchens, of culinary medicine, would not have evolved as far as it has without his spark. And at one point in time, Ben said to me, probably about 2015, 2016, he said, yeah, you know, Tim, no dean wants to be first, but no dean wants to be last. So go home, take that, you know, because I think it applies to CEOs as well. Like nobody wanted to be first maybe at Northwell, but nobody now wants to be last in this movement. And we're seeing a lot of change. The other people are Leah Saris. Yeah. Who, again, we would be nothing without Leah's work, period. End of discussion. And probably somebody reminded me today that we don't talk about enough, and that's Bill Goldring and the Goldring Family Foundation, who stepped up in New Orleans and said, we'll help you. You have those Bill Goldrings in your community. They are there and they care. Go find them. I will stop there. Thank you all. Next year, we talked about next year. We have a really exciting schedule planned for next year. We are almost fully built out for our agenda. We're still trying to figure out the date and time, as well as a lot of other logistics around some of our culinarians and such. But thanks to, I mentioned Andy Vaughn the other day, giving us this framework of Friday, you know, sort of a reboot of fundamental information and knowledge. Saturday being that, you know, sort of what is the state of the art and where should we be with the state of the art. Sunday is looking forward for us. What's in the future? What's on the horizon? Alicia Tucker, who is going to join our team, she's a pediatric obesity specialist at Children's National. She's going to join the culinary medicine team at GW starting in July. She'll have 30% protected time to work with us. She's going to come and speak about the future of anti-obesity medication. We did this back in 2018. The world has evolved very rapidly with this. It is an important part of our toolkit. It's an important part of our toolbox. And she's going to bring us up to the state of the art, but also help us understand where we might be in 5, 6, 7, 8 years. Excitingly, we have Ayas Piros, who's a radiologist, okay? So I know this, stay with me a minute. He's a radiologist, but he's doing AI on x-rays and scans to look for and model for and predict metabolic syndrome at a young age in radiology. So he's going to come and talk about the application of artificial intelligence in preventative medicine, which I think is a very cool idea. Yesterday, when Jennifer was talking about our class, next year, one of the things I want to do with the undergraduate class is have them do an artificial intelligence, use ChatGPT as a tool. How can you use it as a tool? What works with it? What doesn't? I think if we're not thinking about embracing AI in how we teach ourselves, how we teach our medical students, how we teach our residents, then we're going to be pretty far behind the game. I remember, because I'm kind of old now, my father's first calculator, like desktop calculator, digital calculator. And I remember not being able to use a digital calculator in math class, right? Couldn't do it. Well, now you can't not do it. It's just part of it. And so I think as we think about embracing these technologies for ourselves in culinary medicine, how that makes sense. And then the other piece is, Ali Motushari, who is an MIT-trained informatics scientist, is going to come and talk a little bit also about some artificial intelligence, but also how do nutrigenomics apply to what we want to do and translate to that artificial intelligence piece. So we're pretty excited about, really pushing the boat out on where we think about culinary medicine is going to be 5, 10, 15 years from now. Because I know that 5 years ago, I'm not sure anybody would have predicted that we would be doing the level of virtual programming that we're doing now. In the last 3 years, our team has done about 350 hands-on cooking classes via Zoom. Many of you are involved in that initiative with us. So I think this next year's conference is going to be super exciting. We're going to try and open the conference by early July this year and give you all some more information, but stay tuned. A lot of very cool stuff is coming. And I'll close and say the healthcare, for those of you who know a lot about what we do, have read the 10-year report we published last year, we're preparing our annual report now. There's a Venn diagram in that report with healthcare as one circle, food service as another circle, and community as the third circle. And we think that health meets food and culinary medicine fits right in the center of those three constituent groups. We have super robust programming now for healthcare, 65 academic medical centers using the Health Meets Food programming, about 700 or 800 CCMS enrollees. We just signed and just launched our first culinary school as well, that's helping us with the work that Barbara's done, fulfill that food service piece. There is super robust community programming as well that's available to CCMS participants to use our Health Meets Food courseware in your practices, and you'll see a lot of information coming about how you can do that, and as shared medical appointments, for example. But there will also be a lot of very exciting front-facing community programming and tools to help you as clinicians, chefs, and food service professionals in the next year. So stay tuned. You can go to culinarymedicine.org. You can follow us there on Facebook and Instagram and LinkedIn and, I don't know, Twitter maybe. I'm not sure whether we're still on Twitter or whether we should be. We're not, thank you. We're not any longer on Twitter. I'm going to close out and pull up the good Dr. Bosman Ferris to give out our prizes. Again, this is us asking you guys for ideas about what you feel you need for us to be supporting you as this organization continues to grow and thrive. Dr. Ferris. Thank you, guys.
So I am really overwhelmed by this big stack of suggestions that I got. And so thank you to everybody. There's some really, really incredible ideas here. Many of them are sort of following a theme. There are suggestions for content, inflammatory bowel diseases, mental health came up a lot, eating disorders. There are many people looking for assistance or resources to set up community programs. Before I announce the winners, I just want to highlight some of the runners up because I think they're really, really fantastic. And so I don't want to take too much time, but I just want to give you all props for these incredible ideas. And we're going to take these and we're going to review them and summarize them. And so we can use them to help guide what we offer. So even if you didn't, win today, it doesn't, we all win by these great suggestions. So this came from Lisa Ferenc. Sorry if I didn't read your name properly. And this one says, there are so many amazing people at this conference, I agree, and associated with Health Meets Food. Can we figure out a better way to connect all of these resources and people, such as a connect page on the website or an official membership or interest group? So that's a great idea, so that we can all connect after we leave here today, before next year. Another great idea, establishing a National Culinary Medicine Day, right? There's days and weeks for all different professions and all different things, right? So why should we not have a culinary medicine day or culinary medicine week? So I think that's an incredible idea. A line of culinary medicine swag. So hats, aprons, knives, etc. So I think that's a great idea, right? And they can be for purchase, and we can all promote and raise money for the organization. And I think now I'm going to announce lots of toolkit suggestions. So many people requested a toolkit for setting up a teaching kitchen. But the sort of the best one that summarized this idea came from one of our participants at home, and that's Karen Vance. And I'm just going to read her card because it really summarizes all the different needs that people have. So she says, I think a toolkit that lists out all the details to consider when starting a teaching kitchen would be helpful, separated out into virtual and in person, things like insurance, permits, safety equipment, in addition to tech and kitchen equipment. So that really, I think, sums up everything. And the minimum staff to get started, for example, could this be a one-person endeavor? So that was a great idea. So thank you, Karen. We will be sending you one of these beautiful mitts. And then, because I have, as of late, become a big fan of this means of learning, I love this suggestion from Barbara Van Kanen. And hers says, I would really appreciate a podcast, Health Meets Food. There are so many podcasts that promote so much misinformation. It's hard for my patients and me occasionally to separate fact from fiction. So I think that's a fantastic idea. And we have so many incredible people here today that could be guests. So if anybody, wants to be a host, maybe we can start a podcast. So that goes to Barbara. Are you here? Come on up, Barbara. Yeah, thank you for your suggestion. All right, everybody, that's it. Thank you so much.